Well, I think we really do play probably the most important role within this area. Certainly, we know that governments and parliaments legislate, they provide the framework in which to work, but we are there at the coalface having to deal as local authorities on a day-to-day basis with violence, with the sexual abuse of children, and often this is done in secret, behind closed doors. It's difficult to get to the core in terms of getting to know what is going on. Local authority social services departments have to work very, very hard indeed. And of course there's a legal process that authorities have to go through, which we have to make sure doesn't get in the way of dealing with solving the problem, because often the bureaucracy can get in the way. So, we have to deal on a day-to-day basis with really trying to solve the misery for these children within the legislative framework in which we have to operate. So we look to government to help and assist, not to put up barriers which can get in the way that local authorities who have people equipped to work with children and to make sure that that appalling situation they're in is one that we can end as quickly as possible. The people who we've had involved within this seminar today are absolute experts in this field, and I think we've been very privileged to have such experts involved who deal on a day-to-day basis with creating child-friendly services, for example, to raise awareness of children, to actually also talk to parents and other actors of children to help with this prevention of sexual violence, for example. Also, can I perhaps mention the provisions of the Lanzarote Convention? I think we've been very fortunate that we've had the thematic rapporteur, Risa David, who's been very much involved within this work, and she certainly has outlined what can be done at the regional level in actually providing a framework of legislation at that level, which we think is very important to deal with solving this problem of the sexual violence and sexual abuse of children. So that has been very important indeed. So I think what we're saying is that it's the tools that we provide that is what this seminar's been all about. It's practical ways of helping to deal with the trauma and stress that children go through with the appalling situation that they're put in, and that's what the conference has been completely about. Well, it's very simple. It comes down to money, and that is one of the areas that all local authorities have to tackle on a day-to-day basis with their budgets, and spending cuts, I'm afraid, are something which are very much with us in local government these days. What is absolutely vital is that there's a prioritisation made. I mean, how can you compare, the value of a child's life, and we're talking about children's lives within this whole area of the abuse that they suffer, compared with the provision of care for the elderly, for example, with building schools, with providing housing. That's the balance and framework in which you have to work. And all that I would say, at the end of the day, you have to make those hard decisions to ensure that the vulnerable in society are protected by local authorities, and certainly when it comes to spending revision and cuts, is that they are not at the forefront in terms of the service provision, that those services are cut. There are other areas that, quite frankly, should be looked at first before we move into that very serious cutting of and I'm not being melodramatic, but a child's life could be at risk if we have these sort of spending cuts in this area. Also, I think it's cooperation, and sometimes bureaucracy does get in the way, and I think we've got to find ways to get all the actors and the players working together. In English we'd say singing from the same hymn sheet, and I think that is absolutely the right way to describe it. We need to see coordination between social services departments, between health authorities, to make sure that there's a partnership approach and that the youngsters benefit from that, rather than, I'm afraid sometimes, two departments being at loggerheads and actually getting in the way of sorting out the problem for the child who's under this trauma. The least and last thing that they want is for their situation to be made worse by authorities and standoffishness between them. So that is still quite an issue, and one that we're determined to tackle.